Good afternoon, this is Kathy O'Hara from O'Hara and Friends Salon. What we're doing this afternoon is we're doing a public service announcement. Like yesterday, what I told everybody, that we're going to have a local doctor here to talk about COVID-19, and he's not a TV doctor, and he shoots straight from the hip. We're going to do some questions and answers, so this way we can kind of reassure everybody of what's going on.
My name is Dr. Kevin Dolheit. I'm a gastroenterologist and internist on the south side of Chicago. I've been practicing for 25 years, and I practice at 113th and Western, where my dad and my uncle started to practice in 1963. I have an internal medicine and a GI practice, and I practice with Dr. Rick Harris, myself, Amy Knight, a physician and assistant, and Mary Maroney.
Okay, question number 1. If you had cold symptoms but no fever, should you still get tested?
So if you have cold symptoms, meaning maybe an upper respiratory infection, a cough, mild fever, maybe some muscle aches, then those are kind of considered mild cold symptoms. Those could be related to COVID virus or many other viruses. Should that be treated? Probably not at that point in time. It should be watched and quarantined. The patients with the more severe symptoms, like shortness of breath, chest pain, high fever, or have other chronic debilitating illnesses, probably should be looked at much more closely and probably should be tested. Right now the testing is limited, so we can't test everybody, so we have to kind of restrict some of the testing to the more sick or ill or compromised patients.
Question number 2. I would like to know if taking immune boosting supplements would be a good preventative measure, or would it help minimize the effects of the virus if you so happen to catch it?
Sure, I think immune boosting supplements are helpful. I take vitamin C myself over the past 4 to 5 weeks. I believe vitamin A has some effect, vitamin D, zinc, selenium, garlic, licorice. There's a lot of different supplements that have some effect on improving the immune function.
Question number 3. What happens to most that are diagnosed?
Probably of the number of people that have been diagnosed with COVID virus, 70%, 50% may have no symptoms or minimal symptoms at all. Maybe a little discomfort in the muscles, maybe a little bit of a cough or a sore throat. Approximately 10% might have severe enough symptoms where they have to be hospitalized, and a small percentage of them have the risk of fatality. Maybe 2%, maybe 3%. I think we won't know until we have all the statistical data back.
Question number 4. Does blood type make a difference?
From studies that have been done in China, and granted these are preliminary, blood type A seems to have a worsening effect on patients who have a viral infection. Blood type O seems to have a protective effect.
Question number 5. When you order out food to be delivered, do we know for a fact that it's going to be okay, or that it's going to be healthy, or that it's not going to be contaminated?
I would think from a restaurant perspective, that they would be very cautious in making sure that they're handling the food or the bags or anything they're delivering to homes to make sure that there's no risk of transmission of any virus. I would suspect that they probably don't have people that are sick preparing the food or delivering the food, but I still would take a precaution when the food comes to the house. Maybe take the bag out with some gloves, put the inner bag onto the top of your stove or somewhere in your kitchen, and make sure that you Purell your hands or bleach the area before and after you eat. And I would just take general precautions. Not to touch your face a lot is important. And as long as you Purell or bleach the area, I think then it makes it much more safe.
Question number 6. If our children get sick, are we allowed to accompany them in the hospital?
From an adult perspective, the hospitals do not want to have visitors at all inside of the hospital visiting patients, especially if they have a COVID or a risk of a COVID infection. For pediatric patients, it might be different. I'm not sure what they're going to allow. It might depend on the age of the patient, whether they're a newborn or a year or 2 old. I'm sure that they're going to have restrictions that will be well known when you approach a hospital. But they want the least amount of exposure to people who potentially might have COVID infections.
Question number 7. What kind of long-term damage can be expected from this virus?
It's hard to predict what the long-term damage necessarily could be because it depends on how severe the infection is and whether the patient's immunocompromised, whether they have pulmonary disease or cardiac disorders or other problems like diabetes that could complicate a severe infection with a COVID or other viral infections. So only time will tell after the patient potentially leaves the hospital and receives the appropriate treatment can we determine what might be the outcome.
Question number 8, what kind of long-term treatment?
Long-term treatment again will depend also on how severe the infection was and how severe the damage was to the pulmonary or to the cardiac, to the lung or to the heart. That would make a difference as to whether they need any other supportive care. In the short term, the patients may need intubation or close intensive care unit monitoring.
And question number 9, will it shorten your lifespan?
Again, that's a question that really varies amongst the patients who are infected and how severe the infection is and how bad potentially they are immunocompromised before they get the infection. So it depends on whether they have lung disease, heart disease, kidney disease, diabetes, and what long-term effects will only be known weeks or months later.
Thank you, Dr. Kevin Dolehide, for coming and spending the afternoon with me and answering these questions so we can help reassure the public of what's going on.
So thank you, Kathy. It's been an honor to be here. These COVID questions are tough to answer sometimes, but understand that this is a crisis we're all going to get through together. We'll stick with the restrictions and the guidelines set by the state of Illinois and by the federal government. And also remember there is good treatment, more treatment is coming out, and also that we have more testing available in the near future. There is a treatment that has been and is being used from patients who come from local hospitals who have been diagnosed in the hospital with the COVID virus, and it's been the Plaquenil and azithromycin, or the old Z-Pak as we call it, and sometimes zinc supplements, which had had a very good outcome. So we're all in this together. And if you want to reach my practice, we're at 113th and Western with the University of Chicago, Dr. Kevin Dolehide, Dr. Rick Harris. Mary Maroney is a nurse practitioner, Amy Knight is a physician assistant, and our number is 773-834-6500. Thank you again and be safe.